I'm Randy Vawdrey. I'm the medical director of A Mind for All Seasons. One of the clinics asked me to do a case review on the new medication that's been approved for agitation in patients that have dementia. This medication is called Rexulti. And as I dug in and read about this drug, I thought, this is so important. I've got to record just a short video to explain this to executive directors, directors of nurses, and even medical directors of communities who may not be aware of this medicine. So I titled my brief presentation, Is Rexulti harmful or helpful when it comes to agitative behaviors in individuals that have dementia? And I'm going to give you the A Mind for All Seasons or Randy Vawdrey perspective. I want you to watch the commercial. This is the commercial that's aired on TV for all the families to see, families of loved ones who are living in your communities. This is the commercial.
It was one thing when my mom got Alzheimer's, but then we started noticing things that seemed off. She developed agitation that may happen with dementia due to Alzheimer's disease. Sometimes she'd fidget with her fingers, get suddenly overwhelmed, and even throw things. And that was just never her. So we asked her doctor what else we could do.
Rexulti is the only FDA-approved medication proven to reduce agitation symptoms that may happen with dementia due to Alzheimer's disease. Rexulti can cause serious side effects. Elderly dementia patients have increased risk of death or stroke, report fever, stiff muscles, and confusion, which can be life-threatening, or uncontrolled muscle movements, which may be permanent. High blood sugar, which can lead to coma or death, weight gain, increased cholesterol, low white blood cells, unusual urges, dizziness on standing, falls, seizures, trouble swallowing, or sleepiness may occur.
Rexulti helped reduce my mom's symptoms.
Take action for your loved one. Ask their doctor about Rexulti.
It's kind of a heartwarming commercial. A daughter takes her mom who has dementia to a store and they shop and they hang out together. They look at things and mom observes this daughter. This is not very real life. So let's talk about this medicine. The proposed benefits is that it's indicated to treat agitation associated with dementia. And so people that fidget with their fingers or get suddenly overwhelmed, who throw things or just aren't themselves, then we should ask our doctors, what else can we do? We're just hungry for more that we can do for our seniors. So thank goodness there's this medication that's been approved to reduce agitation, right? For those with dementia. I hope you can hear the sarcasm in my voice because I'm going to tell you what I really think about this drug. When you look at the serious side effects, elderly patients with dementia have an increased risk of death and stroke. They have an increased risk of confusion. How do you measure that increased risk of confusion when your dementia patients are confused all the time? They can get fever and muscle stiffness, muscle tremors and movements which may be permanent. High blood sugar, coma, death, weight gain, increased cholesterol, a drop in their white blood cell count. Listen, this has to be monitored very closely. How many of you in assisted living have individuals that get their lab work done every week for the first month? You got to be careful with these medicines. Unusual urges, dizziness, falls, seizures, trouble swallowing, sleepiness. Are you kidding me? These are all things you guys are struggling with every day. Do you really want to give a medication that's going to increase the risk of all of those things? When you go to the website for Rexulti, they say that it's proven to reduce the frequency of agitation symptoms. Your patients are still going to be agitated, but just less frequency. Really? Well, let me go on and show you the data. They used a test called the Cohen-Mansfield Agitation Inventory. Trust me, I bet most of your doctors have never even heard of the inventory. It's never used. We don't use it on a regular basis in assisted living centers. We're just grateful when we can get people to the dining room and get them dressed or go to the bathroom. We're not doing a 225 questionnaire once a week on these individuals. That's the study that was used. Let me show you the actual statistics because this is mind-blowingly horrible. So first of all, when we use that study, the score range is anywhere between an agitation score of 29 to 203. If you did nothing for these clients, placebo reduced their agitation score by 17 points, and Rexulti lowered the agitation score by 22 points. That's it. Placebo got 17 and Rexulti got 22. They said in the clinical trial that this primary endpoint was statistically significant. I would call it crap significant. That's not very significant if you ask me. And it took 4 weeks. 4 weeks of administering this medication to actually separate from placebo in the number of points of agitation that went down when using the medication. What even adds to my irritation is that they allowed individuals to take other medicines at the same time. These individuals could have been started on Aricept or Exelon. These are drugs for dementia. They could have been started on memantine, or they could have been started on Zoloft or Paxil or Prozac or Wellbutrin. So they didn't even separate themselves from other drug treatments. So how in the world do you know that Rexulti gave you that benefit versus just using an antidepressant? It's such a poorly organized study. The second thing that they did in trying to data mine these is they look at secondary endpoints. Secondary endpoints would be, were they physically aggressive versus just agitated, or verbally aggressive versus agitated? Again, secondary endpoints were not statistically significant in this clinical trial, and there was only 1 to 2 points difference between those who were on placebo and those who had a 1-point reduction in an agitation score when we're looking at a score of 203 points. It actually is quite irritating. Again, this receives the poop award from Randy Vawdrey because they didn't even evaluate it outside the use of other medications. And to get physically aggressive behaviors down, they had to use much higher dosing in order to do that. Remember, 4 weeks at higher dosing, it just means much more risk for the seniors living in our communities. They finished with very fine small print on their website that says, the scores trended in the same direction, but with no single factor overly influencing the total agitation scoring that was used. In the end, Rexulti is an antipsychotic medication, and antipsychotic medications have an increased cause of mortality. All causes, stroke, heart attack, falls, concussions, you name it, all cause mortality with these drugs. They're absolutely not good drugs for our seniors. So if you go through and continue to read the fine print, you'll see suicidal ideation, risk of stroke, neuroleptic malignant syndrome. This is a horrible syndrome that seniors can get. Tardive dyskinesia, it's often irreversible. Hyperglycemia, that means high blood sugar. Their lipid panel gets worse. Most people gain weight on it. Their white blood cell drops, so they're at increased risk of infection and increased risk of falls. Don't do it. This medication is not good for our seniors. And so you're gonna say, well, Randy, what do we do? What would we have our doctors do? There are so many things that have a growing body of research that can make a difference, from changing metabolic health, trying to optimize vascular health, not just with pharmaceuticals, but with nutraceuticals, with supplements, optimizing hormones and nutrients. There's a whole host of things that can make a dramatic difference. Lifestyle interventions and non-pharmacological interventions like red light, exercise with oxygen, photobiomodulation, sauna therapy. There's just so many things that could be done. At Person-Centered Review, that's what we do. We work with communities just like you, executive directors and directors of nursing who are looking for consultants in their back pocket that can help them navigate the complexities that lie between families that want more help and doctors who only see the patients for 10 or 15 minutes a week and want to intervene, but feel like oftentimes the only thing that they know to do is to prescribe a medicine. At A Mind for All Seasons, our goal is to work on de-prescribing and implementing strategies that actually really can change behavior long-term without causing an increased risk of death, neuroleptic malignant syndrome, tardive dyskinesia, increasing cholesterol, and so forth. We hope that you'll inquire and want to learn more. Send us an email, info@AMind4AllSeasons, and let's help do some patient-centered reviews for your individuals with dementia.